Welcome to this talk on ethical medical research, presented by Dr. Microlearning. In the next slides, we'll set out the core principles that guide safe, respectful studies and look at practical tools for putting those principles into action. Think of this as a roadmap for balancing scientific progress with real human concerns, with examples and strategies that clinicians and researchers can apply every day. At the heart of our practice sits the Geneva Oath. Put the patient's health first. This means three linked commitments prioritize safety through careful risk mitigation and monitoring, respect participants' rights with clear consent and privacy, and ensure well-being by minimizing burden and securing access to care, all while remembering that generating knowledge must never override individual welfare. Informed consent is the cornerstone of ethical research, and it is more than a signature on a form. Participants must be given clear aims and funding information, an honest account of risks and conflicts, and an unambiguous right to withdraw without penalty, with special safeguards for vulnerable or dependent groups so that consent is truly voluntary, comprehending, and informed. Protecting participants requires a careful risk-benefit balance, shown here as a framework that starts with risk-minimizing study design, continues with real-time monitoring, and includes immediate halting rules when necessary. The goal is to protect individuals, maintain ethical rigor throughout a study, and ensure science remains a public good rather than a private hazard, thereby upholding public trust in research. Fair distribution of benefits and burdens is essential. Studies should include underrepresented groups to avoid systematic exclusion and explicitly protect vulnerable communities so no group is targeted. When inclusion and protection are balanced, research advances can be shared equitably, and no community is left out of the benefits their members help generate, creating shared contribution and shared progress. Microlearning offers a practical way to translate ethics training into everyday behavior. Instead of long lectures that lose attention, short scenario-based videos and spaced quizzes boost retention, fit busy clinical schedules, and turn compliance training into daily habit. The visual comparison here highlights how sustained engagement and small, frequent learning moments produce better long-term outcomes than one-time sessions. Virtual patient rehearsal creates repeatable, low-stakes scenarios with immediate feedback, refining critical skills like language, cultural competence, and empathy. This hands-on practice improves disclosure conversations and consent accuracy in the real world, reducing errors and even lowering litigation risk. So simulated rehearsal becomes a direct route from training to safer, more effective patient interactions. Gene editing raises sharply different ethical questions for germline versus somatic approaches. Germline edits carry intergenerational, potentially permanent changes that demand rigorous safety, equity, and enhancement debates, while somatic therapies are patient-specific with access and cost barriers that can deepen genetic class divides. Both paths require transparent policy frameworks and long-term monitoring to ensure responsible, equitable innovation. Xenograft research aims to address the critical shortage of human donor organs, but it comes with ethical and scientific challenges such as animal welfare, infection control, novel consent issues, and public acceptance. The potential to save thousands on waiting lists is real, yet success depends on transparent dialogue, robust regulation, and a cautious, evidence-based approach that carefully balances risks and benefits. Independent ethics committees provide essential oversight by prospectively approving study protocols, monitoring adverse events, and halting research that violates ethical standards. Beyond these functions, strong committee governance and transparent processes build public trust, shield institutions from reputational and legal harm, and ensure that participant welfare remains the primary concern throughout the research lifecycle. Combating publication bias and preserving scientific integrity means making all trial outcomes public and being transparent about funding and conflicts of interest. Mandatory registration and full dissemination create a reliable evidence base, while declaring sponsors and potential conflicts prevents hidden agendas and protects patients from biased care decisions, reinforcing the credibility and safety of medical research. Turning the ethical oath into everyday practice requires both commitment and systems. A researcher's pledge to protect life, health, dignity, and data must feed a transformation engine of continuous microlearning, reflective practice, and institutional accountability, so that daily actions consistently honor participant trust and translate ceremonial words into measurable impact in how we conduct clinical research.